NHS weight loss injections, the future of diet clubs? Is the NHS introducing weight loss injections a threat to diet clubs? This is the part most people miss. But here's where it gets controversial. While the NHS aims to provide accessible healthcare solutions, critics argue that such injections could undermine the grassroots support and personalized approaches that diet clubs offer. In an article titled, "Rollout of NHS Weight Loss Injections, Is It the Death of Diet Clubs?" senior lifestyle writer Francesca Williams shares her insights on this evolving landscape. With a background in history and journalism, Francesca now blends her expertise with fitness advocacy, offering a balanced perspective on health trends. She highlights the growing trend of medical interventions as a response to rising obesity rates, yet warns against over-reliance on technology at the expense of community-driven wellness programs. The article also explores the role of affiliate links, which help restless remain free to access, while emphasizing the importance of informed decision-making. Francesca's own journey, from a first-class history degree to a certified personal trainer, illustrates the intersection of education, career, and health advocacy. As the NHS expands its offerings, the debate over whether these injections will replace or complement traditional diet clubs intensifies. Will the future of weight management hinge on medical science or the enduring power of community-based support? The answer may lie in the hands of both professionals and everyday individuals navigating this new era of healthcare. Breaking down the stigma. Online pharmacy calls for end to weight loss jab stigma. Stigma alert. The shame attached to ordering weight loss injections from online pharmacies is trapping patients in a cycle of secrecy and fear, and it needs to end now. An online pharmacy has boldly demanded that society drops the negative labels associated with weight loss jabs, arguing that the stigma discourages people from seeking safe, effective treatments. According to the company, many individuals who could benefit from these clinically approved injections are instead turning to unregulated sources or avoiding treatment altogether because they fear judgment. But here's where it gets controversial. Critics worry that promoting easier access to weight loss injections online could encourage self-diagnosis and overuse. Are we empowering patients to take control of their own health, or are we opening the door to unmonitored, potentially unsafe practices? And this is the part most people miss. Data shows that when patients feel judged, they skip crucial follow-up appointments and disregard professional advice, which actually increases health risks. To put things in perspective, weight loss injections, often revolving around hormones that regulate appetite, are prescribed by healthcare professionals for people struggling with obesity or metabolic disorders. When used properly, they can produce significant results, both in terms of weight reduction and overall well-being. Yet the lingering stigma means many patients hide their treatments from family, friends, and sometimes even their doctors, making them less likely to seek guidance or report side effects. Adding context, chemist, druggist, C&D has been a pillar of support for community pharmacies since 1859. As part of Sightline, a North Stella company, C&D prides itself on delivering up-to-the-minute news, analysis, and resources to pharmacists and industry professionals across the UK. Sightline itself operates under C&D Intelligence UK Limited, a registered company in England and Wales, number 1379326, with its headquarters at 3 More London Riverside, London SE1 2AQ. By shedding light on this issue, the online pharmacy hopes to spark a broader conversation about how society views medical treatments for weight management. Do you believe labeling these injections as taboo does more harm than good? Have you ever felt judged for seeking medical help with weight loss? We're curious to hear your experiences and opinions. Let's believe the debate gets started. Shropshire Pharmacist warns, weight loss jab industry a ticking time bomb. The weight loss injection industry is rapidly expanding, and some experts are raising alarms about its potential dangers. In Shropshire, a local pharmacist has described this trend as a ticking time bomb. With more individuals turning to weight loss jabs, many general practitioners are calling them a game changer in the fight against obesity and type 2 diabetes. However, there are growing concerns among healthcare professionals in the region. David Kelly, who operates an aesthetic clinic in Bridgenorth, offers weight loss injections alongside popular treatments like Botox and dermal fillers. A registered nurse at Tinkable, also in Bridgenorth, has shared her personal weight loss journey with clients, aiming to provide insight and support to those looking to lose weight. Despite the benefits, a troubling trend has emerged. An increasing number of people are acquiring these injections online. Mr. Kelly has heard alarming accounts of how easily individuals can obtain self-injectable pens for medications like Mounjaro, Wegovy, and Ozempic. He recounted stories of people using creative methods to misrepresent their weight to online pharmacies, such as filling a bag with weights and sending a photo of a scale rating to secure more pens than they should be eligible for. He expressed concern that individuals can access these drugs from online sources with minimal barriers, raising questions about safety and regulation. Since late June, weight loss injections have been available through NHS Shropshire, Telford, and Wrekin, but strict eligibility criteria must be met. Mounjaro, for instance, is classified as a GLP-1 medication, which helps users feel full by mimicking a hormone released after eating. The Medicines and Healthcare Products Regulatory Agency, MHRA, has emphasized that these medications should only be attained through legitimate pharmacies, including online ones, and only with a prescription from a qualified healthcare provider. They are intended for individuals who are overweight or diabetic, not for cosmetic purposes. The MHRA has also noted that it has not evaluated the safety and effectiveness of GLP-1s when used outside their approved indications, such as for weight loss in individuals who do not meet obesity criteria. In a concerning report, the BBC demonstrated how easy it was to acquire weight loss drugs online by falsifying a patient's weight and submitting misleading photographs. In response to rising concerns, a study was initiated in June to investigate serious side effects, particularly after numerous reports of pancreatic issues surfaced. While many users report positive experiences with these drugs and research indicates potential health benefits, caution is warranted. For example, Teresa, a 50-year-old from Telford, began using Mounjaro in November after obtaining a private prescription online. Although she has lost nearly 3 stone, she admitted to not fully understanding the proper dosage and following her friend's lead instead. "I didn't really know what I needed to do," she confessed, expressing anxiety about stopping the injections due to a lack of guidance. The exact number of individuals in the UK using weight loss drugs remains unclear, especially given the prevalence of unregulated sources. Health officials recognize that while these injections could help reduce obesity rates, they often include side effects, including nausea, constipation, and diarrhea. Nigel Dugmore, a pharmacy superintendent in Donington, has labeled the online weight loss jab market a ticking time bomb due to the ease of access. He believes that the potential consequences of these drugs have not been thoroughly investigated and advocates for stricter regulations. "These are not short-acting drugs. They have long-lasting effects throughout the body," he stated. It is concerning that individuals with minimal medical training can sell these products from their own homes. This situation raises important questions about the future of weight loss treatments and the need for responsible regulation. What do you think? Are the benefits of these weight loss jabs worth the risks, or should there be stricter controls on their distribution? Share your thoughts in the comments.